and welcome to Viewpoint on Ukraine Today. I'm Tamara Rosevan to discuss the issues surrounding reconstructive surgery for war-wounded patients in Ukraine and the international multimedia project bringing awareness to this problem. Joining us in our studio is Dr. Rostyslav Valikhnovski, a plastic surgeon and director and founder of the Dr. Valikhnovski Medical Center. Welcome to Viewpoint.
Thank you. Good day.
So let's talk about your work. You are involved in several projects, including this multimedia one, to help war victims with reconstructive surgery. Now, can you tell us why this is so vital?
Actually, the problem is very high and very important, because now our soldiers are serviced in the hospitals of Ministry of Defense. As soon as they are leaving the hospital, they are meeting new problems. They cannot be covered by state rehabilitation programs, which are not existing so far. That's why our turn, our activity, civil, plastic and reconstructive surgeons, is directed to the help, to the aid to this kind of patients and persons.
And this is important now because I guess in the long run, these soldiers will have a lot of issues to deal with if they don't get the necessary plastic surgery now, reconstructive surgery.
Yes, in the world society, in the world history of our specialty, reconstructive and plastic surgery, there is a system which is covering all steps of medical service to this kind of patients. That's why we can say that there is emergency surgery, emergency trauma surgery, then we have reconstructive surgery. And all the time these reconstructions can last for many, many years, and they can be done in many, many steps. That's why I am voting for the system which can be created in our country, which can be helping our soldiers for whole their life in order to help them maximally. They are our heroes. They are helping us. They are protecting. They are standing on the east of Ukraine and protecting even not Ukraine, but the whole Europe, I would say.
Now, tell me some of these stories that you've obviously already done a few surgeries and helped a few soldiers and civilians through your clinic.
Especially, I can remind some soldiers, and they're already friends of mine, who have come to our clinic to treat the damage due to bullet wounds, due to burn damage, due to absence of extremities, due to different functional abnormalities, such as abnormalities for the upper extremities, lower extremities, such as impossibility to help themselves, even in ordinary life. For example, one soldier which have had, who have had such a defect due to gun bullet wound to his neck and his face. So the bullet has gone through the bottom of the oral cavity and went through the bottom of nasal cavity. Of course, we have seen very bad damage to his face, and we have done our best. Of course, his treatment is continuing, and the question is concerning the functionality issues, but as well as the question is concerning the his aesthetics, his aesthetic view. Because when this gentleman has come back to his family, he have had the problems with his wife, because the wife, she has told him, okay, I don't want to see you in this view, in this appearance. Please do your best, do your maximum in order to be reconstructed and to be obtained by our family members to our maximum.
And so after he had the surgery, what was his response? How was he welcomed in the family?
Yes, the family is existing, everything is much more better, and I'm directing your attention and attention of our audience to this type of example, because this type of example is very specific to all the victims of this war, to all soldiers. We are meeting on the secondary stage of reconstruction, on the secondary stage of the treatment for this type of persons. Of course, we have many, many international colleagues helping us abroad. For example, Germany, France, Switzerland.
And who is funding this project, which has so many partners now, I guess?
Due to discussion to our authorities, for example, with the Minister of our Ministry of Health in Ukraine, we are. We know that this foundation is done by state programs, of course, by many charity foundations, especially international charity foundations existing in this moment. And I would say that many Ukrainian charity foundations, including my own charity foundation, is helping such persons to be reconstructed, to be reobtained by our society. It's in its normal range.
And what do you think are some of the plans of your organization or maybe the state? What are plans to kind of reintegrate these war victims back into society in the long run?
Talking about my team, we can actually help and provide the highest level of medical expertise service in our clinic. Minimum 2-3 persons, 2-3 soldiers per month. Completely beneficially for free, and supporting this type of activity, social activity we do have in Ukraine.
Mm-hmm. And the recovery time for these victims after they've had the reconstructive surgery?
The shortest recovery time is half a year - 1 year. That's why we do need continuing activity directed to this point.
And how does your clinic, or does it have plans to provide psychological help? Is that in the works?
We are specialized in plastic and reconstructive surgery, in general surgery, neurosurgery, spinal surgery as well, including trauma surgery, dermatological surgery. We do have psychologists in our team, and we are helping them during their period of stay in our clinic. But of course, we cooperate with other type of clinics in Ukraine in order to obtain team efforts, resultful efforts, having in the very end soldier which can be rehabilitated properly in each kind of its personality. I mean, spiritual, psychological, and physical life of this soldier can be renewed and can be reobtained normally to 100%.
Now, how many of these reconstructive, I understand your clinic does work with it and you have several surgeons on staff, but in Ukraine, in overall, how many surgeons are there that can perform this type of surgery for war zone victims?
Talking about civil surgeons, we do have, as the members of our association, I'm a vice president of Ukrainian Association of Plastic and Reconstructive Surgery. We have 350 surgeons as the members of our associations. Each of them is ready to help our soldiers for free. We have tens of biggest plastic surgery clinics on the private basis who can join this project directed to this generous and clever idea to help our soldiers.
Well, it sounds like you're doing a good job, and best of luck to you. Thanks so much for coming in today.
Thank you so much. Thank you.
This has been Dr. Rostyslav Valikhnovski, a plastic surgeon and the director and founder of the Dr. Valikhnovski Medical Center. You've been watching Viewpoint on Ukraine Today.